Hey guys, thanks for joining us this evening. I know y'all all probably have busy evening things going on, and thanks for taking the time out to join me this evening as we talk about Universal Chairside Space Maintainer. So, what exactly does that mean? We're gonna dive into that, but definitely I feel like that's a quote unquote game changer here. Either a fan of Mario, Luigi, Donkey Kong, or whoever you favor there. Yeah. So let's hop on into this. So first off, who am I? I'm a dad. These are my four kiddos here. We've got them from Birdie, who's the oldest, down to Dotson, to Emerson, to Little Goldie. So they're wreaking havoc all over the place right now. But we love them to pieces, and that's what makes my world go round right there. I live out in the middle of East Texas, like Alex said. So I practiced in Dallas for many years and moved back home about 3 years ago out here to open up a practice. And I always like to say, I live in a pasture full of cattle. So if I can do this, you can do this. All right. When I'm not at the office, I'm hanging out with my family, and my wife drank all the Disney juice. So we are always at Disney because when you got four kids, not even Walmart wants you to come there, but Disney does. So we are always hanging out there. I did my dental school at good old Mother Baylor, and this is one of my buddies from dental school who's this is a picture of us on injection day on the right over here. If you look at that vial, that little carpule, he hit that IA nerve and vessel all in one fell swoop. First shot, first injection, he got everything there. Now he's an orthodontist and does not have to give injections. So I like to say I saved the world from that. Yeah. I did my residency at Mother Baylor, so I'm inbred there. I had a crazy group of co-residents. We're a pretty large, rowdy group there at Mother Baylor, and we spread all over the place. So here's a few of my near and dear friends right there from my awesome time that I had in residency. I am a board certified pediatric dentist, and this is Laurie Johnson and I. She's the past president of the board. We both did a talk at the ski meeting during the good old COVID masking up time. So I love this picture as a board picture because it's just funny nowadays. I am a past board member for the Southwestern Society of Pediatric Dentistry. So within the AAPD, there's different regions of that. So I've served on their board for many years and just went off that. We do an awesome ski meeting, which next week's in Aspen. So if you haven't been to the ski meeting, you should come check it out. It's definitely a family fun time. So we'll be back at that again. I did a Harris Fellowship project with the late, great Dr. Susie Seal. If you had the privilege to know her, you are blessed. She is now passed on, and I am just so proud to be able to be one of her offspring, if you will, there. And my passion and love for education stems deep, and she is one of the many advocates as we learn and blaze the trail for new things. Dr. Seal was an evidence based lady, but also a huge advocate for new things to come. So I always have her in the back of my mind as we're introducing new products. I'm in private practice. So I'm not in academics. I am full 5 days a week in private practice out in the middle of East Texas. And this is literally one exit from where I practice out here. It is the Cavity Creator. It is a cannon that shoots off candy at least twice a day at this little carnival place called Yesterland Farms. And people gather around in the crowds to get this candy as it rains from the sky. And of course, it's not chocolate that they shoot out of that thing. It's always the sticky stuff that'll take your space maintainers off, but also will bomb your teeth out too. So I don't battle gummy vitamins here. I battle like the hard stuff, the candies. All right. So I always think that's funny. These are my team members here. So this is what makes me look so good every day. So a shout out to these ladies who work so hard to take care of these awesome kiddos that we get to see every day. I couldn't do what I do without them. A love for teaching. I really am passionate about education and helping people, be it doctors, be it my patients, be it their parents. I feel like learning is a pathway for success on so many levels. I've lectured at many conferences, be it from the AAPD to the Greater New York meeting to the Southwest Dental Conference to the Florida Dental Conference. I even hosted a conference for many years called Tatila and Tongue Ties. It's pretty awesome. And so I've done private in-office trainings, large group trainings, all sorts of stuff to Zoom meetings and webinars and things. And so I really enjoy getting to connect with you and share my experiences with you. We all have so much that we can learn from one another. What are we going to talk about today? We're going to talk about this thing called the Universal Space Maintainer, this Universal Chairside Space Maintainer. I want you to understand the difference. What makes it different from other spacers on the market, or from other chairside space maintainers? And then I want you to feel good about understanding how we can actually assemble this, how we can do it efficiently, effectively, how that actually reduces your chair time, overhead costs, and makes it more fluid for you and your team. Okay. So that's really my goal for y'all in this. What is a space maintainer? So this little doohickey guy right over here is a band and loop space maintainer, right? It's got a band that goes over the tooth and a little wire loop that comes forward, and it can be a removable or a fixed appliance, meaning that's glued in. They can be bilateral or unilateral, but really what it's doing is it's helping to hold that space. It's capturing the space. So thus we call it a space maintainer. Why is it important to maintain that space? Well, baby teeth are really important, as we know, not just for chewing, but one of their biggest functions of the molar really is to hold that space together. If we lose that baby tooth early, then we get that shift, or what we call the mesial drift. So that tooth is going to start leaning forward, just like we're seeing here in this picture. So we've lost the second baby molar early, and this first permanent molar, as it's erupting in, is leaning forward. It's drifting forward. As I like to explain to my patients, it's lonely back there. It doesn't have a friend. It's drifting forward to find a friend. All right. And so if we don't have a friend next to it, it's going to start that shifting forward. And so that can cause a lot of problems in there, which can cost a lot of money in orthodontics to spread that space back apart, uproot that tooth, and potentially have to pull the tooth in too. And so that can be exceedingly expensive for the patient, and a huge inconvenience where if we have to lose the tooth early, if we can put something in there to hold that space, what a great service we're doing to that patient. So that's what we're talking about here. That goal of that space maintainer, once again, is to preserve that arch length. Okay, so that's the fancy way of saying that. In a nutshell, we're just holding that space until that permanent tooth can come in. So just like we're seeing here in this picture, this chairside space maintainer is holding this space till this premolar comes in. Once the premolar's in, we take the spacer out, and bada bing, bada boom, we've got a tooth in there and we've got plenty of room for it. Okay, so thus we have successfully held that arch length. So that is really our primary goal here as we're navigating through this. What sort of indications are that? What's the main cause of an early tooth loss? Really, our number one thing is going to be large caries or infection. Okay. If we look down at this bottom one, this is a filling that's failed, it's cracked, and we've got a huge cavity under the top of it that went straight down to that mesial pulp horn, and it caused an abscess under this tooth. We had to take the tooth out with same situation in that picture earlier. We've got that lone permanent molar back there, and it's going to get lonely and drift forward. And so by putting a spacer in there, we're holding all of this space for this permanent tooth to come when it's ready. Okay. Same thing up here. We've had a slight ectopic eruption of this back molar that's self-corrected. So we lost our back root. But then we also, once again, got very large mesial caries that has thus caused an infection under this tooth. So now we've lost this tooth early, okay? So we can have these permanent molars come and get stuck and eat away part of that space, and we need to remove this. Or we could have potential trauma or other issues there. But our number one things we think about really are that infection from large caries there, a non-restorable primary molar, okay? What if that space is not managed? Okay. If we look here in this, we can see how we've had such large breakdown of this molar that we can see how this tooth has already drifted forward. Okay. We're already having space loss here and we haven't even pulled the tooth yet. Okay. This kid definitely probably has some fun times down at that cavity creator cannon down the street from my office here. But definitely he needs help. Okay. Obviously, really high cavity risk. So when we remove this tooth, if we put that spacer in there, we're going to help hold that space. We've already lost some, but to keep from losing even more, we can put that in, all right? That's going to help us make sure that we can maintain all of these things. We get less of this ectopic ruption or mesial drift, that we're getting less of this space loss there, okay? When we get that unfavorable movement, that's going to take a lot of effort to reclaim that at the orthodontist later, okay? So a simple little device perfectly timed can really make a strong impact for that child. So we're thinking about how we can help not only restore their teeth, but also how we can manage their growth and development. Okay. There's different types of space maintainers when we think about that. And there's a unilateral and a bilateral one. So what's kind of our difference there? This top picture is going to be your classic unilateral space maintainer, or what's affectionately called your banded loop. Okay. Once again, it's got the band that goes around the tooth and the loop that comes forward. A bilateral one is one that goes on each side. This one in particular goes on the mandible, and it's called a lower lingual holding arch. You can have a similar type appliance that goes on the top of the arch. For the maxillary, which is a Nance or a transpalatal arch, there's a couple of different options for how you can have those custom made, okay? The big difference is that this only stays on one side, and this goes across on the other one with the bilateral one, okay? The big thing here is that if we're going to be placing a bilateral one for the lower arch, we need to make sure that we've got our lower incisors all present, or we're going to be in a pickle as those are coming in, okay? Some patients can really maintain a unilateral spacer a lot better than they can a bilateral, okay? And sometimes it's much easier to put a bilateral or much easier to put a unilateral in than it can be to have to put a bilateral in, okay? But definitely they have their places in the world, okay? The unilateral one, it consists of the band that goes over the tooth, and once again, that wire that is the loop. When we've got chair side ones, we've got the NuSmile Universal, which is the newest to the market, kind of the mainstream de novo one, which is what I used leading up to the Universal being released. We've got an SML and a Novak as well. So these are kind of the leading chair side spacers on the market right now. Outside of that, there's the good old lab fabricated one, okay? And we'll talk about the differences between each of those and then the differences between the chair side ones that we have, okay? So let's dive into what a lab fabricated one looks like, okay? So with this, it's a little bit different because you're extracting the tooth and then you have to make an impression or a model or a mold of that mouth. Kind of old school way, which is exactly what I still do, is we'll take an impression, okay? So if I'm doing a bilateral space maintainer, I will use alginate impression material. We'll mix that up. We'll use a disposable tray, make a mold of the mouth. We'll pour up that mold and then we'll send that off to the lab to have that custom made. Takes a couple of weeks for that to be made. Then the patient returns for a second appointment to have that glued in. Same exact thing you would do is if you had a unilateral one. You can take like the just one side of the arch impression if you want to, or you can do the bilateral, the full arch impression if you like. Also, with new advances in technology these days, if you've got an iTero or if you've got the AS200E or the AS260, those are sorts of scanners, all right, where you can scan the arch, upload that into the computer, and virtually send that off to the lab. So pretty fancy little things there if you've got that technology in your office. I don't do a lot of ortho or anything like that, so I don't have a scanner. I just have a good old impression for really it's only my bilaterals that I use that for. And if you're like me, you just really love those days. Your team really loves to take those and to pour those up as well. Joking, nobody likes to do those, okay? And so that's kind of a pain to have to go through all the fuss of that impression. And normally the kid really hates it too. So that's definitely a barrier there. But what's a pro of these unilateral lab fabricated ones? One of the biggest things is the strong weld, okay? And definitely that it's custom made for that. And so with that model, it just pops on really easy if it is cemented quickly after the creation, okay? If a month or two goes by and the kid doesn't come back to you, guess what? That lab fabricated one probably doesn't fit as good. And now you're going to have to adjust that wire and bend it to get it to fit, which is super annoying, a huge hassle, and takes even more chair time. So what was supposed to be custom, if patient compliance is low, becomes a big headache for you. And then if you have to remake it, that just increases your lab fees again, which is once again super frustrating. So the really nice thing is this strong weld that it has, because those things are pretty indestructible. But there's lots of potential inconveniences that come from patient compliance and scheduling back. The other big thing here is the cost of it. These things, I called my lab and asked them how much it costs. They said, oh, it costs about $30 for a unilateral one. Plus the cost of postage. It costs you about $5 because I asked my team, I was like, how much does it cost me to mail off this model? $5. That's how much it cost me in postage, let alone the time that it takes for our team members. Okay. I'm a practice owner, so I'm very aware of kind of what my team is doing, how we're spending our time. Are we more efficient for you? Is it a more pain for you? What does that work out? And definitely this takes a lot of staff chair time, from making the molds or making the scans to sending those off to pouring up your models to getting those all cleaned up, writing the lab scripts, sending it off. And time is money. And so definitely your team's time, if it was easier, they'd definitely be on favor and it costs you less of these administrative times. That's also a really big benefit there. We also have to ask ourselves patient cooperation. Welcome to pediatrics. Isn't that what we do every day? Can my patient do this? What do I need to do to get them through this? Sometimes we can get the patient to have one positive appointment, but if you have to come back for a second one, we know that's going to be a doozy, okay? And a lot of times with our bilateral spacers, we're having to talk about, well, do we need to put you on nitrous or not? Do we need to make sure we've got the room available for us to do that in? Because you're not going to be super cooperative for that, and that's going to make it easier. Sometimes they can't come back for that. But if we've got them, let's say, asleep under general anesthesia or with a sedation, and we can easily whip up a chairside one and put that in versus making a mold and having to have the kid come back for that, that's a huge benefit for that patient and is much easier for you and your team. So it's a win-win-win. When we're looking at a chair side one, it's a very similar process where you're extracting that bad tooth out of there. You fit the band over that. You're going to trim that band in the loop. You'll crimp the little tube wire, and then we're going to submit it in and verify the fit. All of that takes less than 5 minutes start to finish with these. They're pretty darn simple. My team members do this for me, and I just check in on it when they're done. So for me, this is a dictatable thing within my office, and it's easily something that my awesome rock star team can do. And they can whip them out really predictably, and it makes it really easy for the kid and on me. One of the biggest pros to this is that literally it is so easy. You just fit that band over it. It just sits there chair side, just like your stainless steel crowns do or your zirconium crowns sit there. There's no impression needed. The chair time for these is very, very minimal. Like I said, you can whip one of these out in like 5 minutes a time. They don't take you that or less. I mean, they're super, super easy. Once again, one of the biggest pros is you don't have to come back for a second appointment. Appointments are time. Those appointments are effort. It costs the parent time off of work, costs the kid time out of school. Both of those are huge inconveniences, huge barriers to getting care done. The parents always are wanting things done in less appointments, and aren't we too? Our chair time costs us money too. And so if we can get that done in one appointment and it didn't add a lot of time on to the end of the appointment, that's a huge win for both you, the patient, and the parent. Okay. One of the cons of these is that you have to adapt and kind of crimp the bands. Pretty darn easy. You've got little pliers always handy by, and so you can easily just crimp away at that. And so the weld for these is not nearly as thick as what it is on a custom one, but we've really come a long way with these weld bonded. And that's one of the biggest things that I'm always looking at as I'm integrating these spacers is how strong is that bond? How strong is that weld from that little loop attachment to the band itself? And definitely that's something that NuSmiles has taken into consideration and understands is an important factor that could lead to the failure of one of these. And I'd like to say I haven't had one, knock on wood yet, that has had an issue yet, because definitely you can see the weld strength there for that. So that's definitely something that I was taking into consideration when I was looking at switching over from one system to the other. Okay. When we're comparing what it looks like between the number one competitor from NuSmiles and the new NuSmiles one, definitely some of the benefits of these chairside ones and looking at it is with the universal one, you have one band. That one band fits both the maxillary and the mandibular one. In the leading competitors version, there is a maxillary and a mandibular band. So you have to have twice as many bands. You have to store twice as many of them, and you have to have twice as many stuff out on the counter if you're doing both upper and lower ones, okay? One of the other huge advantages is there's only one wire width, okay? In the other competitors one, there's the wide one and a narrow one. I don't know about you, but every time I'm having to tell my assistant, oh, it's the wide one. Oh, it's the narrow one. It's not because she doesn't know the difference. It's because it's hard to tell the difference. Okay. You're looking at this thing, you're like, oh, is this the narrow or is this the wide? Oh, no, it's the other one. Hand me the other one. And you've got to order and stock both of those. It's super inconvenient. Okay. And it's very annoying on your team to have to keep up with two different band sizes and two different widths of the wire. So when you only have one wire size, my gosh, you have just made it way easier on yourself. Okay. There's literally 50% less stuff you have to mess with. In my world, that is a huge win. I'm all about keeping it simple. I'm all about keeping it efficient. I'm all about making it easier for everyone involved. And so, looking at inventory, less things we have to deal with, that is so much easier. Okay. And so for me, those were several of the number one things that won me over to these NuSmile chairside spacers is those things. The other thing that I find really frustrating is when you're having to trim the tube, okay? The leading competitor has a longer tube, which at first seems kind of nice, except when half the time you've got space loss and you're having to trim that tube to fit the wire in there. That is very inconvenient to have to like whip out a high-speed handpiece, a 330 burr, trim the edge off, and then put it in the bottom of the little band and wring that out to then fit it in there. Super annoying, but definitely what you had to do. You do what you got to do until there's something better. As Maya Angelou says, you do the best you can until you do better. When you know better, you do better. All right. Definitely, that was one of the biggest things. The first time I used this, I was like, hallelujah. I didn't have to trim that dadgum tube, okay? And so definitely that saves on my chair time and makes it easier for the kid. The quicker we can make this go, the better it is. I know this doesn't seem like an astronomical difference, but my gosh, a millimeter is huge when you're looking at space loss, okay? When you're looking at maintaining space and the ease of putting a loop in there. And so that little bit makes a huge difference in chair time efficiency, okay? As we were talking about with the different loops, the wires on there, once again, that one width makes a huge difference, okay? The NuSmile one comes in a plain straight, in the curved loop, and also in a distal shoe variety, okay? We're gonna compare a little bit what that looks like in kind of a side-by-side comparison, but you don't have all of these extra things that you're having to have stocked that you're really not using. And so if you want the plain one and you want to bend it, great. If you want a pre-bent curved one, they make that. And so that's really nice. But once again, it's that one length or that one width. You don't have the two that you have to mess with. Once again, with the leading competitor, you've got the curved one in narrow and wide. You've got the plain one in narrow and wide. Super frustrating. But once again, you did the best you could till there was better. When we're looking at that curve, I don't know about you, but when I'm doing them, I'm like, man, I feel like this curve is just too big, too low. It's diving down in the gums, or if I flip it over, it's sticking up too high. The height of that is just a little frustrating. With the NuSmile one, it's less of a curve, so it doesn't curve up as high. So the resting point doesn't dive into the gums as much or dive up as high on that wonderful canine, always the canine. It's trying to jump up there and you're having to deal with that, either diving in the gums or diving over the incisal edge. So the lower loop there, 0.75 mLs does not sound like a ton, but when we're talking a baby teeth, everything is so small that little bit can make a huge difference as we're trying to optimize that loop and that wire there. And so I find that that is a very convenient thing to have, is the shorter loop as well. Okay. One of the other big differences here is that the price of the NuSmile Chairside Space Maintainer is about 17 to 20-ish% less than what it is for the leading competitor, okay? We know that it's about 3 times the price to go with a lab fabricated one, but against kind of comparable chairside space maintainers, this one comes in cheaper per one. So it's like $9 and something a unit. So definitely a lot less expensive and less stuff, less hassle. I call that a win-win-win, okay? Let's walk through kind of the step-by-step chairside space maintainer, okay? This universal one, all right? So step one, we're looking at all the stuff that you might need. Pretty much all this stuff's revolving around extractions, okay? We got this bad tooth that needs to come out of there, so we got to numb it up, we got to get it out, but then we also have to have a few extra little things in there to make sure we've got our space maintainer. But our overall armamentarium is pretty low, okay? So we took our tooth out, step one. Step two, we're fitting the band, okay? With these bands, they're easily adaptable over the top. So if you've got a little crimper, I feel like I always have a Hal plier handy. I love that thing. I call it the squisher, all right? It is super easy. It can squeeze these bands if you need it to be a little wider, a little bit this way, if you need to bend the top over a little bit more to make it more adaptive. And that's exactly what I did when I fit this band. You can see on the buckle here how it sticks out just a little bit. I just took that little Hal plier and bent it over just a little bit and adapted it. Super easy, and then it helps it fit a little bit better there for him, all right? I want you to appreciate the size of this tubing, okay? Do you see how much room there is? If you added another millimeter to this, you're barely gonna be able to get that wire into these tubing. Super frustrating. So that little bit of space difference that you've got with this shorter tube length is huge in my book. So I'm really, really glad to see that. Okay. Super easy. You want this band to fit snug and not twist around. All right. We want it to fit nice and tight. Okay. Just like this. All right. We got a nice little tight loop right here. Okay. We don't want it twisting all around. All right. You want it to fit snug. And then once again, you can kind of crimp that over if you need to. Okay. When we're fitting the wire, in this first picture, you'll see how the wire at its full length went over the top of the canine. So it's too long, all right? So we're gonna need to trim that wire. It's not a bad thing to trim that wire. Honestly, you need a little extra length to that. And they're about the exact same length of the leading competitors as well, okay? So it's not any shorter. You can easily cut that with your wire cutters, okay? I've got, you always got those handy. If not, you can take a 330 burr and zip it off as well, okay? So if for some reason you didn't have your wire cutters out, just pick up your handpiece and zip it off there with a 330 burr. Pretty darn simple, okay? What we're looking at here is we want to make sure that that tube fits in nice and snug with the wire. So you're pushing that wire all the way into resistance, okay? Another little hack here to help you out is if when you trim it, you keep one side a little longer than the other, okay? So they're not evenly trimmed. If you keep one a little bit longer, that helps you kind of slide it in a little easier. Sometimes they get really frustrating as you're trying to put those little pieces together with your gloves and you're trying to make sure your fingers are super tight so you can squeeze it in there. Sometimes that's a little frustrating. And so if you cut one end a little longer than the other, then you can slide it in there a little easier, okay? So give that a try next time. That might make it a little simpler for you if you find that frustrating, okay? But once you trim that up, we want that to sit flush up against the back of the tooth here. We don't want there to be any sort of distance. We want it to sit flush, okay? Also, ideally, you don't want it to be buried into the gums, okay? That's where that curved one comes in that can kind of flare up, or it could flare down depending on what the interface looks like on the back side of that tooth that it's resting against. But we want that wire to sit nice and flush. The other thing I really like is if there's a little bit of give where that tube comes together, okay, you can push that wire all the way up to where that tooth comes together. So if you've got a little bit of give, it allows you to push it up with a really nice tight fit. Then you can take your little crimpers or your Hal pliers, your crown crimpers, whatever you have handy, and just squeeze that little tube, okay? And this is what I'm doing right here. I'm taking these little crimpers and I'm just squeezing this tube to lock it into place. I actually do that in the mouth, okay? So I don't take it off, then crimp it. I crimp it in the mouth and just pull it off with the crimpers, okay? That way you get the exact fit that you want, okay? If you take it out, then crimp it, the tube may flex a little bit and it might be either too long or it might be too short. So we want to make sure we're crimping it in the mouth for the most accurate fit there, okay? Once again, you can also take those Hal pliers and just adapt that band again, or you can literally just take and push on it with your crown cedar, okay? Or your bite stick, okay? So super easy there. And you'll see here in this picture how I crimped the top of that. So what we're looking down on is this is the gingival side and the flip side is the occlusal side. So I bent those in just a little bit to make it easy. It literally takes you 10 seconds to just pop that sucker in, okay? So now you've got a nice firm fit. What I always do too is I pull on that wire just to make sure the wire is snug in there and that it hasn't come loose, okay? So before we glue it in, we want to make sure that you've got a nice snug fit, okay? Once we glue that in, what I like to use is the same exact glue that I use for my stainless steel crowns, okay? And so I use this Reliax, all right? What I like about it is that it light cures. So we can zap this with a light and kind of clean it up around the edges and all. And then you get a nice adapted look there, okay? So once again, what I want to see when I cement this is that I want to see there's not a lot of spaces around that, okay? That it's pretty well adapted. I want to see that it's a nice snug fit and it's not moving around. I want to see that this is not dropped down into the gums. Sometimes when you push that down, sometimes it might slide down a little bit. If that wire slides down, you can easily grab your crimpers or you can grab the little like bird beak if you've got orthodontic pliers or the little 3-prong pliers, and you can just bend that loop upward, okay? So you can bend it up out of that. And that's a great time to do that is when you're cementing that and you see it there, okay? But once again, a pretty simple sort of thing. I like to keep everything simple. So once again, I just use the same cement that I would have used if I was gluing on my stainless steel crowns there. So you don't have to have anything special there, okay? One of the big things we want to be thinking about with these guys too, let's kind of hop back to this, okay? Is if we're looking at where we've got, let's say you've got 2 teeth out, okay? I want to just hop back to kind of theoretics here, okay? This is really only for 1 tooth less, okay? I've seen 1 or 2 that have come in my practice where doctors have bridged the space of 2 teeth. So they've got it on the first permanent molar and they were missing both the baby first and second molar, and that loop goes all the way forward to the back of the canine, okay? That's definitely a lot of pressure that you're putting on the weld. That's a lot of pressure that you're putting on the tooth with the band on it, and it's definitely going to flex downward more into the gum lines, okay? And so we definitely want to be conscious of the fact that for these, we're looking at spreading the space of 1. If you had 2 teeth that you're spreading the space of, that's where your bilateral one, so the lower lingual holding arch or the Nance comes into place. These are really shining for the early loss of 1 of those teeth, either the first permanent or the first baby molar or the second baby molar. That's really our main indications that we're seeing here, okay? The other thing that we didn't really touch on, but we also have as an attachment is that distal shoe, okay? And so if you're really a distal shoe lover, just know that we've got those in there and that you can use those as well, okay? But once again, one of the things that I'm really loving about these kind of comes back to that short tube. And I'll highlight that again here, where at first you wouldn't think that 1 millimeter would make much of a difference. But if we extend that out farther in this middle picture, you can imagine how that does make a big difference there, okay? Where if we'd had some more of that space loss, it really would be a struggle for that to be able to close that space or to be able to fit that loop in there without having to trim it up. Just definitely an additional chair time, an additional nuisance there that we're not having to worry about when we've got that shorter tube length. So a huge positive on my end of the deal, okay? Let's hop on forward to here. So kind of just recapping on what we're looking at here. So one of the biggest benefits for these, once again, is looking at preserving that space, okay? As we mentioned for the first primary molar or the second primary molar, if we don't have a space maintainer there, we're gonna get that shifting of the teeth forward, okay? If we don't maintain that, that permanent tooth is not gonna have room to wanna grow in, and then we're gonna end up with issues that are gonna have to be corrected by the orthodontist later. So if we're working through those, being forward thinking in mind and how we can simplify that, these are one of the easiest things that you can do to help hold that space. If you've never made a space maintainer before, it can seem kind of intimidating with all those parts and all those pieces. And that's one of the things I love the most about this. It's just less stuff, it's less parts, it's less pieces. It's an easy fit and easy to do. If you've done these space maintainers before and you've done them for years, you definitely understand the nuances of what some of those frustrations are that you encounter on a daily basis. And so that's one of the big things that NuSmiles has identified are those common frustrations that we as practitioners and private practice feel, from the amount of stuff we're ordering to the amount of stuff that is required to do it. And by reducing that, it makes it so much quicker, easier, and cheaper for you. Okay. As I like to say, if we're integrating in anything in the office, I want it to be a win-win-win. A win for the patient is a must, okay? A win for our team in making it not more difficult, and a win for me as the doctor overall. If that's a win in making it easier, if that's a win in making it cheaper, if that's a win in making it more efficient, that is what we're looking for. And this one is checking all of those boxes. It's a win in making it easier, it's a win in making it more efficient, and it's a win in making it cheaper. All right. And so definitely those are things that I'm looking for as I integrate in things. And this is once again checking all those check boxes. Okay. I put this at the very end of the slide because I always like to say, well, when do you take these things off of there? Okay. So this is the end for this spacer. Okay. We're going to leave these guys on there until we see that permanent tooth start growing through. Okay. A lot of times at our regular checkups and recalls in those 6-month intervals, we can identify that on the x-rays. Okay. We can see it coming. And a lot of times, if it's getting really close there, I'll remove it off of there at that time. Okay. Just at the regular checkup, you just get out the band removers, you put that under there and pop that sucker off. Really easy. One of the things I always do is that you're going to want to put gauze in, like a little throat screen, because definitely you could pop one of these down the back. Okay. And so they can pop off sometimes. So you just want to make sure you have a little screen there. Some people even like to just loop a little floss between it just to hold on to it, just to make it easier, because kids are crazy. They'll just close on that and swallow the sucker. And so definitely you don't want that. So when you take it out, we want to make sure it gets out of there. So either use gauze or use that little floss trick to hold on to that guy there. One of the other things actually I did today is what happens is sometimes that baby tooth gets loose with the crown on it like this, and it's impossible to take the spacer off without taking the tooth out. And so sometimes you end up having to do both. So the kid gets the spacer off and gets a tooth for the tooth fairy too. Okay. One of the other things I like to think about when we're looking at the end of these spacers is how long do we need it in? Okay. In this case, do we need it in until this premolar comes in, or do we need it in until we have another friend back here at the back? And what I always like to tell my patients is if they're maintaining it well, we can leave that in until this tooth comes in. Or if they're really annoyed by it, some patients get kind of annoyed with it, then we want to make sure that we leave it in at least until that back molar comes in behind it. If you've got two friends side by side, you get a lot less of that shifting and moving forward. Okay. And so that's one of the big things when we're looking at the end times for these spacers is we want to make sure that you at least have two teeth behind it that are in before you take it off, or the tooth in the space that's coming in there. All right. If we're referring these patients out, or if we got them in for referrals, let's say that where we're doing treatment on them, I always like to be in correspondence with the referring office that sent that to me. I always like to send them correspondence letters that we've seen their patient, the treatments that we've provided, such as spacers, and that we're here to follow up on those procedures for them if they need to. So if they don't feel comfortable removing these spacers, they can just send them on back to us, and we'll be glad to pop them off of there for them. Okay, super easy. The other thing I kind of wanted to talk about with popping them off of there is kind of what I led with my talk, with that candy cannon thing. All right. Candy will get you every time. I don't know about y'all, but in my practice, October is the time. All right. That October, November, all the kids are out there eating all these crazy candies, and those sticky gummy candies will get you with these. All right. What I tell my patients is that first Starburst won't get you, but by the time you make it halfway through that sleeve of Starburst, you're going to find a spacer in there. Okay. And I always tell the parents too, if the spacer comes off, the kid does not get in trouble. You just hang on to that spacer because we want to glue it back on for you. sometimes these kids get nervous about losing that spacer and they get scared and they throw it away because they don't want to get in trouble. I even had one kid that threw theirs in an Easter egg. All right. It was Easter time. They ate the candy, the spacer came off. They popped it back in the Easter egg, y'all. Threw it back in the yard for some other kid to find. I'm like, what a treat is to find a chewed up candied spacer in your Easter egg. Definitely takes the cake on spacers coming off. And so definitely you want to make sure you're discussing those post-op instructions and everything with the parents and letting the parents know you want to keep it, put it in a baggie and bring it back to us and we can easily glue that back on for you. If you don't tell them that, you'll get calls on the weekends about these. And I always tell the parents too, it's going to be a Friday night at a birthday party when that sucker decides to pop off on a piece of candy. Just put it in your purse, call me on Monday, we'll work you in. It's nothing to get worked up with over the weekend, and that always puts the parent's mind at ease. So I definitely would say we don't get a lot of these that come off, but when we do, we prep the parents really well to know it's okay, don't panic, just hang on to it, and we got you covered. And that has really reduced our parents calling about these once we talk about that a lot more at the delivery appointment for them. So you want to make sure you talk to the parent about what the end time looks like on that and that we'll take it off when it's appropriate. But if it comes off before then, we definitely want to make sure that we save it, we bring it back in so we can take a look and you can easily glue that guy right back on there if they save it, okay? If they don't save it and it still needs to be done, you'll have to make a new one for them. But honestly, as you've seen, it's pretty simple, pretty straightforward, and for less than 10 bucks, you can make another one to put on there for them when you're using these universal chair sides. So it really is a nice benefit and an easy thing to offer up in your practice and is honestly one of the things that my team really likes to do. And so, like I said, I'm not always the one that makes them. I'll go in and check them. But my team has gotten really good at making those. One of our team members made two of them today, was pretty proud of herself, and they looked pretty awesome too. So kudos to her. So I always like to point out that you know anyone can do these. Like I said, I'm in the middle of a pasture. If I can do this, you can do it too. Okay. Thanks, guys, for hanging in there with us today. If you've got questions for me, we're going to open it up for question time now. But I also want to say here's my email address. Please feel free to email me if you've got questions. Or I do a lot of cases and post stuff on social media. Our office page, I run all those social media accounts. So direct message me on there. Give me a shout on that. I'll get back to you too. Sometimes I get to you quicker through social media than I do my email. Things get buried in there. I'm sure you feel that too. So I'll open that up for questions now too. All right. Thanks, guys.
All right, we have one question right now. What is the sizing like in comparison to the competitor?
Yeah, that's a really good question. They are pretty much about the same thing, okay? The shapes are a little bit different from the maxillary versus the mandibular one. And so in the competitor's one, they're a little bit different shaped for those teeth. And this one being the more universal one, you can actually squeeze those bands a little bit easier to adapt it. So that's one of the biggest differences is just a little bit to the shaping of it, but the actual size comparison is basically the same thing. It's just your normal band size there. But once again, the shapes of those being from the maxillary arch and the mandibular arch, they do have a little bit more of a square shaped on one and the rectangular shape on the lower one, where this one just has that more universal size, but you can easily adapt it. That's one of the things I've really liked is that you don't have to worry about that. It's just one standard size that fits over it, but they're not a lot bigger or a lot smaller. They're pretty much around the exact same size. It's a good question. Y'all throw those questions in there, guys.
Can I use the competitor's loop with these bands or vice versa?
I haven't tried that yet. I actually like direct compared them, and took pictures of each of those side by side. And it definitely looked like you could slide that wire loop in there. But I haven't exactly tried that yet. If you'll shoot that question over, I'll be glad to give it a try and see if that loop fits in there. That's a great question. No, but I haven't tried it yet. But I'll get back to you on that if you want to email that question over. Another question that I've gotten quite a bit is kind of how long have these been on the market? And they've only been on the market for about a year or so now. So they're pretty new to the market there. And when I opened up my practice here, I've been open for about 3 years now. They weren't on the market then, so I, fully stocked the leading competitors. But then I brought these in over 6 months ago when they kind of came out on the market for the first time. Got my order in, got them in, just because I really wanted to try that universal band size and that shorter tube length, and I have fallen in love. And so, really, I'd seen them at AAPD when I was there and thought it was a really smart design. And so, I've been using these for almost a year now. Yeah. And I have loved them. Yeah. It's been an easy transition from one to the other, too. Other questions, guys? What you got?
Okay. We have one more question coming in right now. What cement do you use?
Yeah, so let's kind of hop back to that picture. I use that Reliax cement. And so let's see if it'll go back right here. Okay, so I use that 3M Reliax. Once again, I really like this one because it's just super simple. I also like to use one in this syringe too, okay? Because it's just easier for the assistant to squeeze that out than it is to like mix it up on the mixing pad. So once again, I'm kind of more about the ease and the simplicity of it. She literally can just squirt that into the tube, from the tube into the inside of that band and hand it to me. She's not having to like mix it too thick, too thin, add more powder, kind of trying to roll it around that band. It works really, really easy there. So I use that Relax, and then you light cure it. And so you just zap that with your light. I use the Velo 3 second cure. So literally like one cure here, one cure there, 6 seconds, the thing's set and it's hard. And so, yep, so that's the submit I use and how we do that. Good question.
All right, we got a lot more rolling in.
Oh,
So
okay, good.
here's a good question. When do you do the bilateral space maintainer? Oh, when you do the bilateral space maintainer, do you take the impression the same day? Is there a
Yes.
chairside option for the wide span space loss?
Good question. Um, Pretty much standard with the bilateral ones. There is not too many options with a chair side bilateral one. I say that, but I just recently discovered about a week ago or so that there was one on the market and I'm about to order it, okay? Because once again, I'm all about ease and simplicity. So I'll be reporting back in on this unilateral or this bilateral chair side one that I just discovered on the market. And so I'm pretty stoked about getting that ordered and getting that in. Outside of that, there really hasn't been any other chairside bilateral ones, and it's kind of limited in its thing. But you do have to make that mold, and you want to make that impression or that scan at the time of extraction. Okay, so you take the tooth out, you make that impression. So let's kind of go back to that case really quick here. So I take the tooth out, you would make a mold either before you took the tooth or after you took the tooth, fit the band, or have the lab fit the band. Okay.
All right, here's one more. Do you have a preference between the curved loop or the straight loop?
You know, it kind of depends on how it fits in there. Honestly, I kind of just like the plain one because you can bend it a little bit more if you need to. And so, I kind of like that one. But in certain situations, like I'll hold on this picture right here. This could be a really good one for the curved one. Or if you've got kind of that rounded loop of kind of the back of a molar, sometimes has that more rounded. Sometimes that flat one wants to dive down. Where if you have the curved one, it can kind of rest up a little easier at an upright position versus at a straight. So sometimes that curve comes in at a little bit better angle. And so sometimes it's nice to kind of play with each of those. What I'd also say, let's say if you trim one, you don't like it, and then you get the curved one and you trim it, you just autoclave the trimmed one and you'll use it next time. I never throw those things away. We just have various loops. If I tried one, didn't like it, then I'm just going to autoclave it and put it back in there again. We'll clean it because there's no need to throw that thing away. You can reuse it for the next one. So sometimes it's nice to kind of play with them there. Yep, good question.
So the same person that asked that question had a follow-up question about the case selection. When would you use one over the other?
Using the curved versus the
The straight
plain or
loop.
the bilateral?
No, the plain versus the curved. So straight and
Yeah,
curved.
okay.
Yeah.
Yeah, no, that's a good question. I'm going to show this right here, okay? So I don't know if you can really see this guy, okay? But this is the curved one, okay? And so this little curved guy, which is exactly what you're seeing here, okay? In this picture, all right? Do you see how this kind of comes down and comes up? Sometimes that little curvature is what helps you to hold it there better. This thing, this little canine is not very tall. So if you were going to try to put that right next to it with a straight wire, it definitely would be diving down into the gums. Okay. And so that's one of the biggest things when you're looking at it there is how tall is the tooth next to it? Is it short? Is it tall? Is it flat or is it more rounded there? So sometimes those curved ones can be really helpful to kind of move up and hold that versus moving straight in. So it's kind of looking at how the height of it is to the gums and also how that's going to contact each other. No, good question. So that's really the logic of the contact is how you make a difference decision between the curved versus the straight.
All right. Couple of more questions before we finish up. Do you sandblast the inside of the band?
Cool. That's a good question. No, I don't do that. I have friends of mine that do, but that's just extra stuff. Okay. So I have not found that like if let's say it falls off and I got to re-glue it back on there, does it have better success if I take it and sandblast it versus if I just clean it off and glue it back on there? No, I just clean that thing off and glue it back on there. Okay. No, I don't sandblast it. I'd probably end up sandblasting my finger, that'd probably be my luck. But if you had a sandblaster handy, then that would be super great and very easy to do actually. But I don't have a sandblaster because that'd probably be the only use I'd have for it. And I have not found the need or the necessity with a failure of that. If we were saw the continued failure, then definitely that'd be something to think about. But with these, you're not needing that. Yeah, good question.
All right. We have another good question
Good
here.
job, guys.
Have you seen many fractures of these chairside space maintainers?
Great question.
Kids are eating a lot more sticky and hard foods and candy, so I feel like we're taking a gamble putting these non-custom bands and loops.
Great question. I love that. Okay. I feel that. Okay. And once again, that's one of the reasons I like to put that video of, I live right down the road from this candy cannon thing. Like, I feel your struggle. My kids are going to eat candy no matter what around here. They're going to eat cotton candy. They're going to chew gum. They're going to eat gummy bears. They're going to eat the sugar daddies. They eat Swedish fish. Who eats Swedish fish? Okay. All of that is really normal in populations and particularly mine. Okay. I've had one failure in the last almost 10 years of doing these. Okay. I have almost strictly done chairside space maintainers and not, I can only think of a few times I've ever had a custom lab ordered one. Okay. And the failure that I had was the leading competitors. Okay. It wasn't a NuSmiles one. And that was only one in literally all the years that I've been doing these chairside ones. And so definitely the better the adaption of that, if it's a longer loop, you're risking the fracture of that. And if it's not as well adapted to the gums, you're potentially risking that. But that is one of the big things that NuSmiles took into account. And I was asking a lot of questions because I feel you on that question. I don't want to be making a change to a technology that's going to fail. And I'd say that's one of the big things when I think about Dr. Susie Seal, my EBD queen in my life, that she always said that practitioners in private practice, as they integrate new technologies, they're going to be the ones that set the stage for the research of tomorrow. And if they find that it doesn't work for their patients, that it's failing, that it's not efficient, that it's not good, they're going to stop doing it and we won't have research on it because it's going to fall out of favor. Okay. But if it works well and they're doing it well, they're going to share their knowledge. They're going to share that with us. And that makes the research of tomorrow. And that's really what I feel in this product is that it's so good. It's so simple. It's so easy that it's definitely a win-win-win across the board for you. So I think if you make the change over from that lab fabricated one that you're going to find that, yeah, it has a really sturdy bond to that strong weld that it's still working really good for you. And it really simplified the process for you.
All right. Thank you, Dr. Curtis.
Yeah. Thank you guys. Y'all were awesome. Good questions.
Okay, I think we have time for one final question. Um, uh, do you ever have these get pushed into the gum tissues at times? So instead of coming out, getting pushed in, instead of coming out, they get pushed instead. And what is your approach when this happens in terms of removal and cementing in regards to timing?
Yeah, definitely you're going to have some of those that drop down, okay? Particularly on the canine, okay? When the first baby molar's lost, and the band goes on the second baby molar, and that loop, the wire goes forward to meet the canine, just like we're seeing here, okay? This little curved one helps us keep it from diving down. So this is a great example of a time where you'd want to use the curved one, okay? But you can still use a really nice plain one if it looks like it's meeting really good there and it's a good hold, okay? If it drops down into the gum line, a lot of times I'm just monitoring it and telling them to keep it clean. Because if you're familiar with a distal shoe, okay, this distal shoe, that little metal piece, okay, dives down into the gums as well. And so we know that it's not going to induce an infection or induce any issues if it's just sticking down into the gums a little bit. Just like orthodontics, man, that stuff digs all in their gums too. It's not comfortable, but definitely is it hurting things? Not necessarily, okay? So I'm not popping it off and re-cementing it if it just dips down into the gums a little bit. I'm telling the parent that we want to get a little bit of Listerine Zero and scrub that area there to make sure we keep it nice and healthy. And then if it becomes more of an annoyance or a nuisance for the kiddo, then definitely we can. But we're identifying that as something that we can work with, and that's okay, and just part of the process. All right. If it dives super deep down in there and gets bent down, definitely we're going to pop it off, readjust it, and cement it back in there again. Okay. I tend to find that I actually have more annoyances with the bilateral ones rubbing on the lower than I do these chair side ones. Okay. I just popped off one of those bilateral ones with like a little omega loop down in the bottom. The omega loop was now the kid's mouth grew and now it's rubbing a little funny. So I had to take it off, bend it out a little bit, and then glue it back in because it was rubbing a little ulcer there. With these chair side ones, they're not rubbing, they're just sitting there. And so I tend to find that you get less of kind of like the irritated gums, just more of it sitting down into the gums. Good question.